So the process of mercury removal is a careful process where we're protecting the patient, ourselves, and the environment, and sort of simultaneously doing all that. And the way we discuss it with patients, it's similar to like taking out some kind of toxic paint on a house or something like that, or even asbestos. And the training is known as a SMART certification, which is safe amalgam removal protocol or technique. And there is also another protocol that I learned from the IOMT, which is very similar. And we shield the patient by making a gasket so that their fillings are just exposed outside their mouth with a gasket, a rubber dam. We isolate that. We cover the patient completely, and we also give the patient some air. And we wear our respirators, and we have some other equipment in the office that is cleaning the air and limiting any kind of vapor that's coming off the fillings. So that's how we describe it. And it's very similar to having a filling, except we're covering the patient. So people make a big deal out of that it's trickier than a filling, but it's logistically very similar. We take the mercury out fairly quickly, and then we clean up the patient, and then we just do our fillings as normal. Well, we feel that the scatter of any particulate is controlled, and there's been studies on this. It's about 20 centimeter scatter, like a target, so from the tooth out up. So we feel with the suction, intense suction that we use, we're really limiting that pattern. So I would say if the patient's able to be covered and doesn't have an issue with claustrophobia or any kind of thing like that, then I feel like they can go home and they're clean. The setup for mercury removal, we're hoping that the patient has a practitioner that's helping them with their gut, and their liver, and these pathways we want opened. So what we want to say is, if we're detoxifying the mouth, can the body detoxify itself well? So usually there's a practitioner helping with that. Let's say that happens and their diet's good and they're going to the bathroom every day. These are all things we ask the patients. And after that, a couple days before, we're bolusing with vitamin C, about 2 grams a day or more, up until that point. And then that day they cease the vitamin C. And then after, we're going to be doing the same thing. We're going to do 3 days of vitamin C again. So there is a pre and a post sort of mechanism we're using. So we started doing this about 2010, and I've been pleasantly surprised that the body's amazing, and what it does is it walls itself off from that filling. So if I take a filling out carefully and we take most of the stain and we kind of be careful about how deep we go, there's no sensitivity, usually no sensitivity, and this tooth just, for all practical purposes, just has a replacement of the toxic material with a more biocompatible material. We get the bite correct, and we control nighttime grinding and all those things. There's usually no significant negative to taking them out.